Okay, welcome back to Bounce Around Charleston. Here with me on Bounce Around Charleston, well, he's a doctor, he's my first cousin, and he wrote a wonderful book entitled Diabetes, Not Just a Touch of Sugar. Dr. C. Stewart Darby, welcome to Bounce Around Charleston.
Thank you for having me, Randolph.
Yes, sir. I read your book. You were at a conference recently. You autographed a book for me, and I read it, and I thought it was interesting, and I felt like my viewers needed to know about this and get this book. So tell us what motivated you to write this book.
Well, I've been practicing family practice medicine for the last 27 years. In my years of practice, I've treated over 1,000 diabetics. I have close family members that are diabetics. I'm a pre-diabetic myself. So it became an epidemic in the last few years. And with the COVID, I had time at home to actually complete the book. And I just want to get the information out there to my patient, my family, and my peers.
And I like the phrase, not just a touch of sugar. Explain that.
Well, I'm from the low country like yourself there, and everybody refers to diabetes as sugar. So when I first started practicing in the 90s, I would have a lot of my patients who come to me and said, I just got a touch of sugar. But some of them were about to get a leg amputated, about to go on dialysis, about to have a heart attack. And it wasn't just a touch of sugar. So I decided to frame the book, not just a touch of sugar, but it's actually a little more serious than that. So that's why we decided to go that route with the name.
Well, you know what? I've heard that too. I just have a touch of sugar.
That's right.
So what should people be aware of when noticing life change?
Well, the thing that was for diabetic, we like for them to recognize symptoms, and we like everybody to know your family history as far as what runs in my family, because diabetes is genetics. I mean, if your parents, your grandparents had it, sometimes it trickles down to the family members. So know the signs, know the symptoms. We tell everybody when you get family gathering, whether it's Christmas, family reunion, find out why your aunt or your grandparents died to know what runs in a family. So you ask people to look for the symptoms. When my patient comes into my practice, we check everybody for diabetics because there's about 100,000 people in South Carolina that's got diabetes that don't even know they have it. So we check everybody.
And what are some of the symptoms?
Some of the symptoms is frequent weight loss, frequent urination, being extra thirsty, having back pain because of the kidneys and everything. Those are some of the main symptoms that we see.
Wow, back pain.
Back pain, yes.
Wow, because I've got some friends who talk about back pain all the time.
Yeah.
So they should go and check to see whether or not they're diabetic, huh?
They should check, and their primary care doctors, they should check everybody. Like I said, I check everybody to walk through my door, whether you got symptoms or not. And we discover a lot of people have no symptoms, what we call asymptomatic, and they're diabetics or pre-diabetics. So there are ways that we got listed in the book that you can actually prevent from getting diabetes. And that's what we like to push, try to prevent from getting it.
And in your table of contents, what are some of the chapters of your book?
With some of the chapters, we talked about diet. We talked about exercise. We've got a cooking recipe in the back of the book. We're talking about ways to lose weight and ways to prevent diabetes. We've got about 10 ways that you can actually prevent diabetes, like regular exercise, drinking lots of water, losing weight, quit smoking, reduce your portion sizes, try to eat less. And as far as sedentary lifestyle, we like folks to get off the couch and move more. So those are some of the examples we use in the book.
Well, you know what? When I was reading your book, I saw where you stated, don't be sitting down so long.
Yes. That's one of the things that we recommend. And people go to work for 8 hours, and a lot of times they'll probably sit 6 to 7 hours a day. We want you to get up at least every hour and move around, because that's the circulation problem that we find out with a lot of people. So we want movement. So whatever you're doing, your work, whether you're a computer or you're a school teacher or whatever, we want movement. Movement is one of the key to keeping the diabetes at bay.
I'm going to take you up on that one, because when I get on my phone and I start looking at Facebook, I'm on there for a while, just sitting there going through it. So I'm going to take you up on that.
Good.
Okay, explain to me the difference of AC1, AC2?
Oh, A1C.
A1C, I'm sorry.
A1C is a blood test that we do. That test that I check every patient that come in my office. It's called A1C. And it's a blood test to show me your blood sugar for the last 3 to 6 months. Now, you could do finger sticks on patient, but that only shows you 1 day or 2 day of blood sugar. But when I do the A1C, that tells me 3 to 6 months, your level of your blood sugar. So that's more of an accurate test, whether you're diabetic, pre-diabetic, or not a diabetic at all. So the A1C tells us everything. Now, there's different types of diabetics. There's type 1 and there's type 2. The type 1 diabetics is the kids of people that are normally born with diabetes. Those are folks that got to have insulin. The type 2 diabetic is the adults that gets diabetes after a later date, and they normally can be controlled on pills, diet, exercise, and sometime with insulin. But the type 1, everybody got to be on insulin. With the type 2, is a little bit different.
Okay, so what we should do when we go to our regular doctor visits, we should make sure that he's checking us for diabetes, huh?
Yes, definitely. Because like I said, there's well over 100,000 folks just in South Carolina alone that's got diabetes that don't know they have it. No symptoms at all. But if you go for your annual physical and they do the blood test, they can let you know whether you're diabetic or whether you're pre-diabetic or whatever. So that test should be done on almost every patient every year as they come in.
And I guess a person can be walking around not really knowing that they have diabetes, huh?
Yes, that's right. Asymptomatic. And you could be sometimes at a point that you need almost a kidney transplant or amputated leg or that far along and still don't know you have any symptoms. One of the part of the areas that I work in is the zip code 29203. It's here in Columbia, and they've got the highest amputation rate in the state of South Carolina. Mm-hmm. And that's because folks go so long and don't go untreated per se. And then the time they go to the doctor, it's so far gone, they lose the eyesight, the kidneys are failing, they need an amputation at that time. So we advise people to get your annual exam. That's the key, annual checkup.
And what is the real major cause of diabetes?
Well, a real major cause is becoming insulin resistant. We all have insulin in our bodies, but as we get older, sometimes we become resistant because of being overweight is one. Eating habits, eating too much sweet, drinking too many sweet sodas and Cokes and stuff like that. So your diet is really important to actually curtail the diabetes from happening, the diet and exercise.
And what about the sugary drinks?
The sugary drinks is definitely a no-no. And I advise my folks, stay away from the sugary drinks. And I know they want to have those colas, but try to drink the diet-free Cokes or sugar-free drinks. Don't put too much sugar in the tea. And South Carolina is a tea state. It tastes just like sugar. And just watch your sugar and your sweet intake, sweet potato pies, cakes, and stuff like that.
Now, what about pasta?
Well, pasta is carbohydrates. And I tell my patients, watch the white stuff that you eat because the carbs do turn into sugar in your body. And the white stuff we talk about is bread, rice, pasta, and potatoes. All the white stuff. So you still got to be mindful of the carbs because the carbs do turn into sugar in your body.
Dr. Darby, tell my viewers how they can get this book and your website so they can go there.
Okay. Well, the book, like we said, is called Diabetes, Not Just a Touch of Sugar. And we are on Amazon. So you can go on Amazon and get the book. We also on Kindle. We can do the e-read where you can just publish the e-reader and read it on your laptop or your phone. So we're on the Amazon Kindle, or you can actually email me, my website, and I can get your book and actually autograph it for you. So we can do a book signing at any event. So we'll be at the International African American Museum when they finally open for the Black Taste of Charleston coming up in March, we hope. The dates are being pushed back, but we'll be doing a book signing at that event also.
Dr. C. Stewart Darby, we want to say thank you for being here on Bounce Around Charleston, sharing with us diabetes, not just a touch of sugar.
Thank you very much.
Thank you. Well, you heard it right around Bounce Around Charleston. Diabetes is not just a touch of sugar. We'll be right back after this break.